the electronic submission allows a normalization of the case. And there is one electronic format, XML. I don't know if you are familiar with XML. And I just show you one slide on XML file. It's a extensible markup language. It's a standard for exchange of safety and acknowledgement message in pharmacovigilance. But in fact, XML format is a common tool for data transmission. I know you are familiar maybe with HTML, which is a format to display data. So you can transform any document, Word or Excel in XML format, just to show you what is an XML. And it's important to standardize the safety data. So that's why there was 10 or 20 years ago the need to have a common language in electronic language. So this is the history of E2B, and it was supported by ICH, okay, which is the International Conference of Harmonization of Technical Requirements for the Registration of Pharmaceuticals for Human Use. So ICH is joint initiative between authorities and industry, pharmaceutical industries, and there is 3 regions: the Europe, Japan, and the United States, who are working together, and there are 6 parties, regulatory bodies and research-based industry, and there is 2 observers, and they're making some standards. You can find quality topics on the ICH, safety topics, efficacy topics, or multidisciplinary topics, and the E2B standard, and the electronic standard, in efficacy topics, and you can find the E2B guidelines. Do you have any question? No? So you're going on the website of the ICH and you find the E2B guidelines. For the moment, the current version is E2B revision 2. To know that E2B is under revision and will be changed in a new version, and they will integrate, we will see later, the medicinal product. It will be centered around the medicinal product. That's why this day I will show you something which is going to change completely in the next very short time. Just to show you, this is the website of the European Medicine Agency, and they require the E2B standard. You can find ICH in Europe, in the US. They have to report case safety in E2B standards, and as well in German. I can not read Japanese, but I can recognize ICH. So you can find ICH everywhere. And what is E2B standards? It's just to report some safety data. So you find a field with the administrative and identification information, with the unique identification of the case safety report, the primary source of the case, and you will have information on the sender and the receiver of the case. Then the report will be the patient characteristic, the reaction, the results of tests, the drug, and the narrative. Okay? This is the structure of E2B, and each field, E2B field, have a number, a special number. I will show you in the database, in my database. And just you know, when you have a safety database, it must include all these fields to be E2B compliant in order to report electronic cases. No question? This is part of the screenshot of my database. You can see the E2B field. You have the identification case safety report, primary source, patient characteristic. I don't know if you can see clearly. And this is the database with the E2B, and this is it's from the guideline E2B. So it respects absolutely the E2B standards. The things to know is each E2B field is structured. Each field is structured with, there is some technical documents. For example, the reporter address of the case should be strict 100 alphanumeric characters. You know, it's very standardized. It's technical. You have the E2B guidelines, and then we have the technical documents. And some E2B field can be constrained by a drop-down list with defined value. For example, here for the reporter, the E2B NE214, it's physician, pharmacist, author, lawyer, consumer, and you find the list on your database if it's E2B compliant. Yeah.
What happens when you have miscalculation? Back of the report, you don't have all the required data.
Yes, when you have you have only some few mandatory fields to report. You have the sender, the identifier, and I will show you the E2B validation. That means the minimal requirement to send a case, to have a valid case. Yeah.
When you say harmonization of the E2B, you mean harmonizing the fields?
Yeah. Yeah, it's very important to have the same restriction of your reporter everywhere in the world. It's physician, pharmacist, author, lawyer, consumer. Yeah. It's just to have the same, just to have the structured data in order at the end to have signal detection. You should have a lot of. It's a consumer, you would say. It's a consumer. It's a patient. It will be impossible to have the same. Yeah.
Right. The form is being filled by the sponsor or the CRO, right?
The form this form, it's a database, just to see you, it's a E2B compliant database. You can find it on the market. But you can feel it can be filled by anybody in pharmacovigilance. It's just to show you when you have a database, if you want to know if it's E2B compliant, you have the E2B guidelines, and you have to have this in your database.
But you're basically talking about the systems, right?
No, not only clinical trials and post-marketing.
Post-marketing, you have the E2B is for post-marketing and pre-marketing. It's just your safety issue, just your case.
The standard structure.
Yes. It's a case, any pre or post-marketing, you must have this information. You cannot put for you, if I told you it's a elbow therapist, you cannot put this. You have to choose between this list.
When you are in post-marketing, because when you are in the clinical trials, you are choosing some other field that will allow you to be in the side of clinical trials. So when you are at the beginning of you're filling in your case, you say I'm post-marketing, I'm in clinical trial, then you have different fields to fill in, but it will always be the same structure and the same drop list.
Wait, where is my phone? I need to enter. Okay. There is some values on the E2B field which are defined by the guidelines. For example, your patient weight, if it's not null, of course, should not be superior to 650 kilograms. Okay. And the height, for example, is not higher than 250 centimeters. Okay? So if you write your height is 300 centimeters, you will be, when you're going to do your E2B validation, you will be you have an error message. You say it's impossible, please check your height.
This is an E2B requirement that there are limits and that.
Yes, that the limits are defined in the technical requirements.
And the system highlights when we make mistakes.
Yeah. Let's talk about the reaction by itself, and E2B guideline asks for Medra coding. Your reaction must be code with Medra. I don't know if everybody knows about Medra or
Yes.
Yeah. So you can see the headline. It will be only the Medra lowest LAT must closely corresponding to the reaction must be. So your database basically should include the Medra dictionary, or you can. Let's see an example of my database. I have the Medra dictionary, so you can code with the LAT. Medra is part also of the ICH. You can find on the ICH. And one important thing. So everybody knows Medra, so you can go?
Yeah.
Okay.
We know the name.
Either you or Google.
What?
Either you or Google.
Okay. So Medra is medical dictionary, regulatory activity. It's part of the ICH. 20 years ago, there was the US dictionary, European dictionary, Japanese dictionary. It's crossed out throughout European dictionary, and they say stop ICH. We mix every dictionary and we set up one dictionary with the Medra. So Medra is contain disease, diagnosis, signs, symptoms, therapeutic indication, medical and surgical procedure, medical, social, family history. You can code everything with Medra. Not everything, but they're including now some medical device terms, because medical devices are becoming very, there's a lot of clinical study running with medical device, so it's very important. So they add some terms. This dictionary is updated 2 times a year, on March and September, and now it's 70,000 terms. And you will see that these terms to code, your reaction or medical history or is divided, or your test also, all the investigation like code by Medra, is divided in 26 system organ class. You can see blood, cardiac, ears, endocrine, eyes. You can code almost everything. And once you have your reaction, you have to code with the lowest level term, which is very specific. Okay? Just one thing, Medra dictionary is free for academic hospital. You can ask Medra and register to Medra, and you will have the Medra dictionary for free.
I would like just to add that what is very interesting in Medra for already a long time, and because I have worked a lot in misuse and off-label and medication errors, you have a description of all kinds of wrong administration, wrong site of administration, wrong route of administration, wrong timing, wrong dosage, overdose. So you have a lot of choice. Also to code all the misuse, the off-label use, the overdose, the abuse, all the things you have. It's very rich to understand exactly what is going on. And the way you are coding, it's already helping you to do your signal detection at the end. Because if you are doing things very well, at the end you have very good signals.
Yeah, that's it's very important. And the one more thing. Okay, so you can have Medra in your database, or you can set up in your desktop. It's quite easy, and you can see if you want to acute myocardial infarction, it's part of the cardiac disorder or the vascular disorder. So please choose the primary source to code, because it's Medra convention. And I don't know if you know the points to consider. It's it's very a guide for coding. If you are not, you don't have internal guide for coding events on your industry or on your society, you should use the point to consider, and it's very helpful guide. For example, you receive a case with respiratory chlamydial infection. You can code chlamydial infection, respiratory infection, or you can code respiratory infection or chlamydial infection. And the MEDRA points to consider told you that it's better to code 2 reactions to have the maximum information instead of respiratory infection or chlamydial infection. Okay, so it's very helpful for the reactions. You have the bacteria and the locations. So it's very practical there in useful. So once you have your safety data which is complete and meet all the experiments and have to be reported, you can, from your database, generate an XML file. This is the XML of the case, for example. And before generating the XML file, you can validate your case, E2B validation. So it's an automatic program on your database, and that integrates these rules. This is the business rule. It's a specification document. You can, for example, drug treatment duration unit is mandatory if 15 is not null. You can say it's rule every, so it's important to have that. So when you do the E2B validation for a case, for example, I took a case from my database, and I did the E2B validation, and my case was not valid for the post-market because study style must be individual patient or other study. And my case is also not valid for clinical trial. Okay, and I take another case and I perform the E2B validation, and my case is not valid for the post-market, but it's valid for the clinical trial, which is my field of work. Okay? So if you want to understand the E2B validation, you have to read all these documents. It's very technical, but it can be readable. Okay. So maybe I stop, or just to show you how to report a case or individual safety case reports, how a case can be sent electronically to the European Pharmacovigilance database, which is Eurovigilance. I continue? Just to remind you that in Europe we have a common regulatory framework for all the 28 countries. For the moment we have 28. So we have one directive for clinical trial and one regulation for drug safety. But there is now a new regulation. There is difference between directive and regulation. But anyway, it's the same thing for the 28 countries. For a clinical trial, reporting is mandatory, and it's based on the Eurovigilance system, which is established. It's a database and maintained by the European Medicine Agency. It's a single database for European regulatory authorities, and we have to report SUSA, which is suspected unexpected serious adverse reaction, which is unexpected case in clinical trial, in the special module of Eurovigilance. Okay? And Eurovigilance allows to report the case to EMA and national authority, from industry to regulator and between regulators. They can exchange with Eurovigilance, the national authority can exchange their case. And Eurovigilance allows also to exchange the report in E2B engine format. And you can enter your case through a gateway. It's mainly for the big pharma. Or you can enter your case by using EBWeb, which I'm going to show you. The EBWeb system is for academics, for poor people, with few cases, few users, or EBPost. So to have it's for reporting studies adverse events when you are performing, when you are sponsor or clinical trial in Europe. You have to, of course, have a trained and qualified person, because we will see that Eurovigilance asks for qualified person, and we have to pass an exam after 3 days of training. And you also have, it's a validated database that meets E2B requirements. We have to report, that is the part of the regulation, this unexpected to the competent authority, okay, to the ethics committee, and to Eurovigilance. It was very new, the electronic reporting, so it was 2004, and we have 7 or 15 days to report. So when your case meets criteria of unexpected case, you enter your case, of course, in your database, and from your database you generate XML file, and you can send to Eurovigilance. It's a secure connection by gateway, EBPost, or EBWeb. The EBWeb system, gateway, is very there is no human intervention. Also by EBPost, you post your XML. By EBWeb, you integrate your case, and you can rework or see your case you sent. I think it's a nice way to work. So practically we report SUSAR in Eurovigilance. You enter in the website of Eurovigilance. First of all, you have to register with Eurovigilance. It's mandatory for marketing authorization holder, national competent authority, and sponsor to report it electronically. So you have to designate one qualified person responsible for pharmacovigilance. And you have to have one person like that in your society or industry, and you have to 1 or 3 days exam training, and you have knowledge evaluation, and you must pass the exam. If not, you repass the exam. Yeah.
Is it applicable also for medical devices?
No.
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 Not yet.
Eurovigilance is medicine.
Not yet.
The idea is to they are creating a database. Just it's the medical device regulation, which is very near to be released in Europe. It's copied the drug system. So yes, it will be a medical device Eurovigilance.
Perhaps just 1 or 2 words about this training, this certification in Eurovigilance, because it's someone we are working very closely with, Kaline Longo. I don't know if one of you have been certified Eurovigilance. If you are in a company, you have the obligation to have at least 1 person in your company to be certified Eurovigilance if you want to send cases to Eurovigilance. And it's linked to the person, not linked to the company. If this person is leaving, you have to have another one. This is the first thing. Second thing, you have the registration. Tu vas en parler?
Process?
De la certification de la vigilance? Non, des personnes qui veulent être certifiées, tu en parles, ça? Non? Oui. Voilà, je voudrais juste dire 2 mots là-dessus. If you want to be certified Eurovigilance, you have now 3 days, which is only for sending the reaction. But now we are not only sending the reaction, we are also registering the products in the XEV MPD, the Medicinal Product Dictionary, which is mandatory in Europe. Meaning that if you want to do that and that, you have to be certified for it's about 5 days, and it's one of the worst exams I have had. And it's really a mix of IT, of business rules, of regulation, and it's a tough exam. So you have to stay on your seat during 5 days with Kalinin is wow.
Yeah, I know it's. You have at the beginning of your drug vigilance when I did the training, it was okay for to send SUSAR and to send drugs. Now I have to repass the training because they implemented the XEV MPD, so I have to redo the training to be able to enter drugs because it's completely changed with XEV MPD. So it's true that it's very hard training. It's yes. 3 days and you have the exam.
2 days for the
and 2 days, yes. And you have an exam, and the English people doesn't have with the exam, so it's not funny. Hello UK. So you will say, I will say it's just the training is for one person because when it's my login, I put my login, and you can manage your profile, okay, and you will see it's my name. You can see, but yes, it's my name on the who is responsible for your drug vigilance for the Hospice de Lyon, okay. So the nice thing is you have one person who is doing the training, and this person who have the diploma can train the other and can register the other, okay. So you go to manage your profile, and you can add user. But you have to send your ID, you have to send some form, special form with your phone number and email, and it's very and sometimes they call you to verify if you exist. The call from UK for all the user I registered.
So the center is in the UK?
Yeah.
If I understand correctly what you said, all of us, if you want to report in the vigilance, we have to take a course.
Yeah.
Taking place in the UK.
No, it's everywhere in Europe.
As well.
It's something that we could organize with ISOP and with Bioforum. So I think that we have the right person, which is who is the Kalinin group, who is doing the certification for your drug vigilance, and with a partner of Claude.
I think it would be a nice idea to organize because Claude are already organized in France because we have to register.
Yes, Claude is doing the certification for France in French.
Yeah, in French.
Déjà pas mal.
Yes. What?
What do they teach in the training?
In the training, they're teaching you a mix of all the business rules, meaning that for each, how many cases do we have in the database? 263 or something like that?
286.
286. For each field, you have to know what is the regulation, the E2B regulation, and after that you know that by heart before coming. They will tell you, but this is a business rule, the technical rule, that we have to write this on this way and this way. Here you have a drop down, and if you are mixing the receipt day and the receipt day out, even you're having just one yes,
They explain you the E2B and the E2B in Europe. I mean, what they want in the E2B field for Europe. So you have to follow and to learn how to.
And it's very
So it has to be 100%. You can't make any mistakes.
Some mistakes you can do, but very few. But some mistakes you are not able to do.
The fact is,
how many people do they have passing?
No, but if you don't pass your exam, you don't have the password, so you cannot report.
But you do it again and again. So
you do it till you pass. No, it's okay.
Because they don't want to have enough people.
No, only the very clever people like us.
So is it possible to manage this course in Israel since
If we
people
At least
if we have enough people,
you need 12.
12 people.
I think we have here more than 12 people, right?
Yeah, but we are not obligated to report to the
No.
If
Not
you
all
do,
of us.
but if how many people are doing clinical trials, let's say
In Europe.
In Europe, everyone who is doing
Which really-
clinical trials in Europe has to report there.
Yes, you have to report. Yes. Of
So
course.
we are more than 12.
If you have one site in Europe, you have to register.
Okay, at least I have to do this course. I believe that
send us, because it is something that we were discussing with Claude and Kaline. We were discussing last time I was in France. How many people do we have that could be interested in the certification? One, two, three.
If you have at least one clinical trial, one site in Europe, you have to report to your vigilance, or even in, so.
Okay, send us.
J'adore ciseaux.
so I have to send you
Yes, to Bioforum, because Bioforum is, we will have the website which will be released. We have the LinkedIn group for Eyes of Israel, which is also the place where we speak about what we want. All of it is exactly what you told you, that we want you to say, we want to have this and this and this.
We don't have a choice here.
No?
All of us have to undergo this course at some stages of our life if our product is going to be
In Europe, anywhere.
trials or used.
And very possible that in Israel you will come to that, because this morning we were speaking with Dorit, and she said that a database from in Israel is the E2B database. So it's very possible that one day the Ministry of Health will say exactly the same thing that you have been doing, saying we want you to pass this certification.
I know that now the guidelines which are in the internet refers you to the European guidelines.
So
according to European guidelines, you have to report.
But I mean, you have to report only if you have a site, trial site in Europe, okay? But I mean,
If you want to market.
Or if you want to market, you have marketed, and in order to be
once you have marketed, you have to report. So
you have no choice.
you have no choice, you have no choice. So the thing is, you have to pass.
Maybe can you speak of the training XBNPD in 2 days?
But the fact is, when you are, yes, I will show you something.
Just if you, excuse me, if you have not the first time your exam, your certification is not a problem, because you can pass twice this exam. Okay? All people.
The goal is not the objective is not to put people outside, because they want you to it's just that they are very tough, and they are very so you are obliged to do it, and you are obliged at one point of the time to pass the exam.
You have to pass the exam for vigilance. You have access to this database. This is your vigilance, but you also have to pass the training for sending a product. It's the same interface. You enter the vigilance and you click on products, and you can create your products and you will send to your vigilance. Okay? Yeah. So there is 2 training. The split in 2 training because it's so heavy. This is the access to send a product to XCDMP. Okay? So. Maybe we can stop.
Can I have a question?
Yeah.
Does the vigilance that through by the hand of the regulator, or does the marketing holders can use it as their own to monitor all the data of their product?
Yeah. Okay. The regulators have all access.
Yeah, of course.
The industry have the access to their product only. Okay.
So then
They cannot request for, I mean, I don't know, all the case of the database. They have strict
this is
limitations.
absolutely
Right.
true. This was not my question. My question was, let's say I am the user of some
Yeah.
company. So can I manage my own data without requesting the authorities? Can it be as a software tool for my own use?
Yeah, absolutely.
So
It can be used like that, but it's not very practical. But when you, I mean,
this is my question.
Yeah, it could be like
Why, if this can be
you
used as a
you can have all your stuff in this here. You can have in this item ICSR. You have all your CSR you sent or you're not sent. You have not sent.
Then why then the European companies should use this tool?
You will see. I mean, it's not. Yes, it's a good question, but it's not very easy.
I think that
Because
you can answer
Yeah,
that.
no. Because if you not, I'm not sure. The case you find that it's all the case you sent.
Yeah, that's
So you send only the SUSAR. It's maybe in clinical trial it's only 10% of your case.
okay.
So you miss 80%.
So you send, so you report to individuals only.
I mean it's an expected case, so it's 10% of your case.
It's a clinical trial.
Clinical trials.
But in the post-marketing.
In the post-marketing, you report all the serious.
Only the serious, so you don't have the
Only the
non-serious.
The non-serious.
No, but non-serious are only reported within 90 days.
Yeah, 90 days.
Not yet.
Not yet, yeah.
Not yet. Not yet.
Yes, but I don't. Can you do a search signal detection with?
No.
You can do
No, it's a job. No, we can do anything. It's a job of EMEA.
You can just see. You can just see what you have entered. That's
Your case. You send, of course, your product. You start there?
Yes, je pense que tu n'auras pas de questions dans le... Ok, we can...